medication administration video. So I'm going to get started. Of course, I do not have an IV pole and I don't have a person, so this is going to be my person. He already has his IV connection in already, and this is my IV pole. I'm sorry, I don't have anything. So what I'm going to start off by doing is, I don't have water or a sink or anything, so I'm going to be washing my hands using friction for about 20 to 30 minutes. Some people sing Twinkle Twinkle Little Star. I myself sing the birthday song, so I'm going to be doing that. And also, to get started, before you get started with anything, I do want to say my 6 rights of medication administration, which is the right patient, the right drug, the right time, the right route, the right dose, and the right documentation. Also, before you give any type of medication, you are going to make sure that you identify the patient and you have some type of verification. It depends on, long as it's 2, it does depend on the whatever facility you're at. At my facility, we do use either the patient's birthday, the patient has pictures in their chart, as well as the MRN number, which is the medical record number. So long as they have those things, you have to have 2 patient identifiers before you can administer any type of anything for a patient. So I'm going to get that out the way. I done verified my patient and everything. So I have my kit right here, and then before I open it, I'm going to explain every part. So this right here is the spike in. The spike in is what you connect to the medication or the bag, you know, the fluid. That's what you do right here. This right here is the chamber, the drip chamber right here. This right here is my roller clamp, of course my tubing. This right here is the adapter that you connect to the patient's IV site or central line or peripheral line, whatever the patient has. This right here is the Y site right here. So did I do everything? The Y site, yeah. So that's everything right here that I need. So before I get started, I will be putting on my gloves. Gonna do the best I can. I'm a little shy, even though nobody's looking at me on the camera. I'm a little shy. So I'm going to do this. First, I'm going to start off by opening up my bag. This is normal saline right here. Before you do anything, of course, it depends on the facility, but you do want to label your whatever your medication. Even if it's normal saline, you do want to label your medication. Usually at the facility that we work at, they usually label it with the date and the time, and then below it it's like the date that you're going to discard it and the time that you're going to discard it, and you have to put your initials on there. That's just our facility, but I just want to put that out there. So this right here, so I'll do that with my spikes in right here. I'm gonna undo this right here. Gonna make sure that I do not touch the spike in right here. You're not supposed to touch that. You don't want to contaminate it and or anything like that, because this is supposed to be sterile, you know. For right now it is. And also this, I'm going to discard that as well, and then applying pressure. Got it. Okay. Also, whenever you're priming anything, I want to make sure that the clamp is locked, because I don't want the fluid to just, you know, be going all the way down. So what I'm going to do is try to squeeze this a little bit, just to put about that's about enough, 2/3, that's about enough, into the drip chamber. After I do that, I'm going to hang it up. So, oh, can I do it? I thought it was going to be easy for me to hang it on here. I don't have anything to hang it with. Yeah, I thought I was going to be able to hang it on here. Oh, woo, I did it. Hey. So anyway, this is going to be 30 inches above your patient. So we're going to do that. This right here it's already covered, but what I'm going to do, you can not do it all the way, but just a tiny bit, but still keep it covered because we have to prime the tubing. We want to make sure that it's no air bubbles, because that's not safe for your patient. What is it called? A air embolism, I believe. Don't quote me, but I believe that's what it is. So you always want to lock this. So what I'm going to do is unroll it just to make sure that I prime the tubing. And then see, it's dripping out a little bit like that. So of course I would be like over a sink or something, because you know, so I closed that right there after I did the chamber. And then after I did that, what is next? I labeled it, made sure there was no bubbles. I hung it above the patient. Also, I'm going to show my calculations right here. So it was 150 mLs to be administered to the patient. So I put on the package it said 15 GTTs. So I did that. I put it over 60 minutes times 150 ml. So the calculation is right here. 15 times 150 equals 2,250. So you're going to divide 2,250 by 60. That's going to give you 37.5. You have to round it up, so that's going to be 38 GTTs per minute, okay? Because you always round it up or down. So since it's a 5, you round it up. So that's what I'm going to do. I'm going to, after I do that, I'm going to take this, because now it's safe to, you know, put it inside, connect it to your patient's IV site. So now I'm going to connect it because there's no air bubbles. So now, since we did the other part of it, so now we're going to be administering the amoxicillin piggyback, or the secondary, you know, medication. So I have my secondary tubing right here, which is a little bit shorter than the other one. We're going to do the exact same thing. So this is the same tubing with the spike, the chamber. It has the adapter for the patient and a roller clamp. The only thing about this one, it does not have the Y. What am I saying? The Y side, okay? So I have everything right here. So, and this is the medication, the amoxicillin. Of course, we're going to do the exact same thing that we did with the normal saline. We're going to do the 6 rights, that I said previously at the beginning. And then, of course, the 2 patient identifiers, as well as labeling. I can't stress that enough. That's what I do. Well, I was taught to label everything. So anyway, we're going to do that. I have my medication right here. So what I'm going to do, I'm going to close off this again. Close this off. I'm going to connect this to this again. Remember, I can't touch that. I'm going to connect it. My patient is, I have such a good patient, so calm, doesn't complain or anything like that. I'm going to flip it back over again, squeeze about right here, because of course you want to see the drip coming down. You want to be able to see it. So if it's all the way up there, of course you can't see it. So I have that, and usually when you have this right here, you hang this above the other fluid, the normal saline, but I don't have a higher place to hang it, so that's the only reason why I'm not. But of course I know that you're supposed to. Hopefully it will fit right here. I don't even know. Okay, I did my best. So it's hanging right there. My calculations are right here. The amoxicillin is 250 milligrams and 100 mLs of normal saline to be given over 15 minutes. So what I did was I did the 15 GTT over 15 minutes times 100 mLs. So that's what it gave me. 15 times 100 is 1500. 1500 divided by 15, 100. So 100 GTT per minute. Okay, I have that right there. So of course I did my calculation. And then what we're going to do is the white port right here, we're going to connect this to the white port. But the only thing about it is we have to take our alcohol wipe right here, because of course it's been out for a while. So we have to make sure that we clean it. I'm going to take this, don't touch it, of course. I'm we're going to connect it. The thread right here is going to connect to it. And remember at the beginning I already told you that we did everything, primed the tubing, everything was primed. I did everything exactly the same as before, where I primed the tubing, made sure that everything was flowing properly. As you can see, I did that. Hopefully you can see the, you know, I don't know if you can see it, but of course it's primed, there's fluid in there. Okay, and then after everything is administered, everything is connected, of course I regulated the fluid to make sure that it matched what was on the medication order. So I did everything like that. I did everything for my video. Okay, thank you so much.